This episode is all about the longest day, and we are making sure that it will be a part of that movement of yours. The longest day, for anyone who doesn't know, it is technically the summer solstice, which I don't know which scientist made that up, but it is the longest day of sunlight on the whole globe. But the Alzheimer's Association did say that it would be their biggest marketing fundraising day of the year because we're going to shed light on this dark disease.
You're going to be in a caregiver space some point in your life, whether you need it, whether you are it, you're going to be in that space. When you find yourself in that role, whatever the barriers are, whatever those feelings that you're feeling, just know that there is someone on the other end. Just know that there is that other helping hand. A lot of the times we think that there's not, or we think that I won't be qualified, or I won't, they don't want to hear my story. Yes, we do.
I think that one of the things I would like to say is that people have to first own that they are caregivers. I think that that is one of the barriers.
Parenting Up, Caregiving Adventures with comedian Jay Smiles is the intense journey of unexpectedly being fully responsible for my mama. For over a decade, I've been chipping away at the unknown, advocating for her, and pushing Alzheimer's awareness on anyone and anything with a heartbeat. Spoiler alert, this shit is heavy. That's why I started doing comedy, so be ready for the jokes. Caregiver newbies, OGs, and village members just willing to prop up a caregiver, you are in the right place.
Hi, this is Zeddy. I hope you enjoy my daughter's podcast. Is that okay?
Today's supporter shout out is Miss Jelana Hayes. She's with the A.G.R.E.E.D program. Yep. Y'all know we still in Detroit and we about to do this thing. We about to keep doing this thing. She says, I really enjoy what I've seen so far on the podcast. Listening to the caregivers share their stories was very inspirational. Thank you for creating a platform where caregivers can get real information and know they're not alone. Exclamation point. You know what I'm saying? We are not alone. You're not alone. I'm not alone. You are not alone. If you want to receive a supporter shout out, y'all know what to do. Leave a review, Apple Podcasts, on YouTube, on IG. We are parenting up everywhere. Holla at your girl. We in Detroit. Detroit. This is our first tour, and it's happening in Detroit, okay? You just get ready, baby. You know how they do it up here. What up, though? What up, though? And this is the day that we are bringing you that fire, that Detroit fire. Woo! So wherever you listening, wherever you watching, just get ready, baby. Sit down, drink something, sip on something, eat on something, but be safe. Today's episode, who caregivers can call, real life resources. What's up, Parenting Up family? You see it. Yes, I am still in the Detroit city, baby. I like saying that. What up, though? What up, though? This is our third and final episode in our Detroit tour around caregiving, okay? Right now, this is the thing. This is the one. So what we're talking about on this particular episode, we are going knee deep in 3 very specific areas with organizations that are on the ground in Detroit, making it happen for caregivers. Like right now, already, they got resources for you. That means code for you ain't got to spend no money. They already got some stuff and know how to do some stuff that you can lean on them. Okay? Ain't that sound good? Like, look at me blessing you for free. Come on now, who's giving you that kind of stuff this day and age? People stealing stuff from you, taking your taxes, trying to take Social Security. Anyway, that's okay, I'm going too far. So, welcome everybody. Now they gonna tell you in a second more about themselves, but I'm excited because I now know what some of these acronyms mean. So this is I'm trying to. She wants me to be casual with her, but I can't. This is Dr. McNeill. I call her Dr. Detroit. I'm gonna try to call her Dr. C today, but I'm probably gonna call her Dr. Detroit. Okay, but the one and only, she is here representing Wayne State, specifically the A.G.R.E.E.D program.
Yes.
Y'all, it's a $5 million grant. I could spend an hour talking about how you get a $5 million grant, but I ain't gonna do that. Okay, and then we have Ashley with the Alzheimer's Association Detroit chapter. Right? I ain't lying, am I?
Yes.
I'm telling the truth.
Yes.
Oh, Michigan chapter. See, I was lying. But ain't Detroit all of Michigan? That's what Detroit thinks. But the rest of Michigan as well. And then Courtney, D-triple-A. Shout out to anybody who know what all the A's are in the right order. It's like playing the Scrabble board on the old school Soul Train thing. But where the A's go? Where the A's at? What's up, Courtney?
What up, though?
What up, though? What up, though? All right, so listen. Caregivers are underappreciated. I'm a caregiver. I'm going to just tell you what we feel most of the time on our insides. Family caregivers who are unpaid and untrained specifically. We feel unseen, unheard, unappreciated. But y'all and your organizations don't feel that way. Y'all love us. Y'all appreciate us. Y'all got stuff for us to help us. Please tell us about it.
So I'll start with the Geriatric Workforce Enhancement Program. That's the GWEP in the state of Michigan. We were the only one in the state of Michigan funded for $5 million to improve the care that geriatrics receive in the state of Michigan. And to do that, one of our elements is to empower our caregivers. So we actually have continuing education for them. We have training for them. We have resources like apps and programs, podcasts. We're actually taking programs to these senior apartment complexes and providing that right delivery right there where they live to help them be more educated about falls or dementia, early detection, where resources are. So our particular grant covers the state of Michigan, and we're compiling all of the caregiver and geriatric specific resources in one space so that we can then be able to enrich the training that we provide for our caregivers, our patients, our providers, everybody to be better equipped to care for our most valuable asset, our geriatric population.
I love the old people. As you said it in a really fancy, probably politically correct way, our most valuable asset, our geriatric people. What I like to say is I love my grandmama and granddaddy more than I love my little bitty cousins. That's how I like to say it. You know what I mean? Because my grandparents have been there for me. I don't know if these little bitty cousins gonna act right. You know, they cute now, 2, 3, 4, 5. It's fun to play with them. But when they get older, are they gonna do for me? My grandparents have already shown up and showed out. So I feel like it's my turn and my opportunity to care back for them. Something you just said, Doc, that really caught my attention is apps. All right. So now if y'all gonna have apps and stuff, then that means that the current generation who only likes to deal in digital and technology, they gonna have some help in caregiving because it's a whole lot of people out there who are either having to come home from college, maybe not go to college,
Right.
or do college part-time because they're assisting as a part of the care village.
Right.
And I think something like apps might make it easier for them to know how to help with the family or even just to feel a little more engaged.
Yes, that is the goal. So this particular app is called the Remember My Elder or Remember Me app. And so what that app does, it uses AI to identify resources in your particular area. It also allows you to hold healthcare systems accountable. So one of the evidence-based programs is called the Age-Friendly Health System. And every time a 65 and older person enters the healthcare system, they should get a certain type of care. And we're looking at medications, mentation, mobility, and what matters. And all 4 of those M's should be addressed every time you go to see a provider. So the app will help you keep track of that. And even if your provider doesn't ask you, you can tell them voluntold. That
I need that app.
You can voluntold them to say, this is what's been going on with me and my mobility, or this is what's been going on with me and my mentation, and I want to have a conversation. So just a tracker to kind of help that conversation happen a little better.
I need a tracker.
Okay.
For my mama. Maybe for me too. Hell, for all I know. I know my mama hadn't gotten but one of them M's. We ain't got no 4 M's. I can tell you that right now. We have definitely not gotten 4 M's. Thank you so much. All right. Who want to go next and tell me a little bit about what y'all got going on for resources in Detroit? Or in all of Michigan? There I go again. Y'all know how it is. My bad. Michigan.
I can go. Yeah.
Okay.
At the Alzheimer's Association, we have our programs team, and what we do is we have education programs for anyone who wants to learn any information about Alzheimer's or dementia. We have things that some of our topics go over dementia conversations, and also like legal and 10 warning signs and understanding. So we have about 15 topics, I would say. And
Okay.
then also we have support groups. There are support groups all over Michigan. They can be virtual or in person. And then they're for caregivers or for people in early stage, or there are also some support groups for other types of dementia that we have. And I would also say that we have care consultations. So we work with master's level social workers. They're available for families for up to 6 weeks for a family that may want a little more guidance on like what to do or how to set up the best possible position for their loved one. And then also we have social engagement activities, and those social engagement activities include, like, we have a partnership with the Detroit Orchestra. They come out once a month to play for the loved ones with Alzheimer's or dementia. And they also do things like go to the Henry Ford Museum or the Detroit Zoo, just to really keep them active in the community.
Yeah. Detroit is always a party. I don't know if I'm not calling nobody out, but I don't know if I've heard of other chapters, partying with they folks with dementia. But I think that's a great idea. I think everybody deserves a party. Actually, we should just all be partying more, right? It probably would just make a lot of stress feel like it's melting off our backs. Mm-hmm. Now, with these things, Ashley, is there a fee or membership? Do you have to be you got to sign up for the Alzheimer's Association? You got to pay $5? Mm-hmm. What does it take?
No, all of our programs are free to the community.
Hello.
All you have to do is
hold
call
on, pause.
us.
Y'all hear that? We giving y'all this good. It's how many things that are free and useful. Free and useful. Keep going, baby.
Oh, yeah. So, yeah, they're free to the community. All you have to do is call our helpline, 1-800-272-3900. I have to memorize that at this point. I say it so many times. But, you can just call the helpline and they can direct you anywhere you want. I know we also are doing, one thing I also want to highlight is the DEI that we're doing. In particular, we do Jewish outreach, Hispanic Latino outreach. I do African American outreach, and then we also do MENA community outreach. So we're really trying to reach out to those vulnerable populations that may not get the information and resources. They know of them less, I would say, yes.
The Parenting Up community would like to take a huge moment and say thank you to the Alzheimer's Association for standing 25,000 toes down in DEI. And it is amazing that you even share that and bring that up, because this episode is all about the longest day, and we are making sure that it will be a part of that movement of yours. The longest day, for anyone who doesn't know, it is technically the summer solstice, which I don't know which scientist made that up, but it is the longest day of sunlight on the whole globe. But the Alzheimer's Association did say that it would be their biggest marketing fundraising day of the year, because we're going to shed light on this dark disease. See, I was listening to one of them webinars, and so I know that is something that people can rally around. And if you're looking for community as a caregiver within the Alzheimer's Association, that's a time and a place where everyone gets together, whether you want to do or walk, or you want to do crocheting or something. Somebody is doing something fun and free. Fun and free. We
Yes.
love both of those. We love both of those. All right, Courtney over there.
Yes, I'm from the Detroit Area Agency on Aging. You're right, it's a whole lot of A's, but we do a whole lot of work as well. Our caregiving team is, we have a dynamic caregiving team. And one of the things that I find most important is that we are a listening ear. You can always give us a call. Our caregiving team is on staff, ready to receive, whether you're in a crisis, whether you just need to talk to somebody, whether you need to figure out how you're going to navigate this new role, or you've been in it for a while and just don't know the resources available. Our team is there to help you figure that out. Some of the resources that DAAA can directly provide, we allow you to choose what kind of respite care you want to, or which way you want to go, whether that's an adult day program. We have some overnight programs that are available to our caregivers, and we offer training and education in those areas as well. So you won't be alone when you go to the doctor. You'll have either one of our caregiver members, or you'll have a script. You'll have all of the necessary information that you need to feel confident as a caregiver to go in and take care of your loved one. In addition to that, we provide so much reprieve. We have events. We just had hosted our caregiver pamper day, where we had
Wait, hold on now. I ain't get that invitation. I could have come up here a couple days early.
Yeah,
Pay for me.
it was beautiful. We had a beautiful comedian come in. We
That's
had
so ugly.
a meditation moment. We had yoga there. A beautiful DJ, and we stepped because Detroit does step.
That's
Okay,
true. That's true. Now, where them
And
fans at?
where them fans at? Okay, and we had a blast doing that as caregivers, and just taking our minds off of the role that it is. Some of our caregivers had to even bring their loved ones with them, and guess what? We were right there. You don't have to worry about a thing. We got your mama. We got your auntie. We're fine. We're over here. You go do that. And so that's just one of the many ways that DAAA is supporting our caregivers out here.
Okay. Now, listen. I'm sitting here and I'm listening to y'all, and I feel like every caregiver, at least in Michigan, okay, should be fully fortified. But obviously, at times, people just might not be aware. They may not be aware as much work as you all are doing, and as much effort as you have put in to supporting the community. And each of your organizations have been around for, and when I say a minute, I mean y'all ain't started last year. Right? And for those who know about you, they sing your praises. But there are others who may be so new to caregiving or to this space and to this universe that they just don't even know where to start and how to find you, like, at all. So if you could go back just a tad to before you were fully entrenched in this space, what would you tell a person like that? What's the first thing to do to feel welcome or to reach out to one of your organizations? Like their family member maybe just fell for the first time, or they're thinking about maybe going to a primary care place to get a diagnosis, but they're too scared to go by themselves. And they're like, yeah, I heard that girl Courtney say they would go with me to the doctor, but my mama, but I don't even know if I want to take my mom to the doctor. And how the hell Courtney gonna go with me? You know what I'm saying? People could have those types of hesitancies. What can you offer to help them let their guard down?
Just to tell them that they're not the only ones. We are here. This is you're going to be in a caregiver space some point in your life, whether you need it, whether you are it. You're going to be in that space. When you find yourself in that role, whatever the barriers are, whatever those feelings that you're feeling, just know that there is someone on the other end. Just know that there is that other helping hand. A lot of the times we think that there's not, or we think that I won't be qualified, or I won't, they don't want to hear my story. Yes, we do. We absolutely do. When you go to pick up that phone, we're going to be there. You Google us, D-AAA, DAAA. And as soon as you do, we're going to pop up. As soon as you call, we're going to answer the phone. Only thing I can tell you is just make that step. Do it. Don't be afraid. Do
That's
it.
better than police. Now they didn't say it. All right. So any federal, city, state, or county funds or resources that might support their organizations, don't harm them. That's me. All I'm saying is it sounds to me like there's more. I can count on y'all better than the popos. Anyway, I'm not about to talk about the Atlanta Police Department. So, what do you have to say about that, Doc, for individuals who just may be a little hesitant because they literally are so new to this space of being a caregiver?
I think that one of the things I would like to say is that people have to first own that they are caregivers. I think that that is one of the barriers. If you just see yourself as, I'm just a daughter doing what a daughter is supposed to do. When you hear D.AAA or Alzheimer's Association say, we have these caregiver resources, you may not connect the dots because that's for those caregivers, maybe people that are trained or people that's not for me. But we're here today as a unified community to say that if you're providing services for a loved one, a neighbor, anyone that kind of depends on you for your assistance, your advice, your expertise, then you are a resource. And to support you are these other resources here to kind of help you identify, okay, what do I need now? And when that changes, okay, what do I need now? So again, you're not feeling like you're in silo. And I think that that's kind of what happens initially is that people get into this role and then they feel overwhelmed. They feel like, okay, I'm recreating the wheel every time somebody gets into this space. But we have been there enough and been there in that space long enough where you don't have to feel like you have to recreate the wheel. There's resources already established in your community.
Mm-hmm. I love it. And I'm going to say, look, for anybody who is, for those of you who are hearing us, you can't see these facial expressions that me and Dr. Detroit are throwing over here on Courtney. We throwing them hard. It's a no-look pass from Magic Johnson or from Isaiah Thomas. I'm going to shout out the Detroit Pistons. Because before we started recording, we were just chit-chatting casually. And I was asking if any of these sisters here on the couch dais with me were currently in a caregiving role. And we're just going to fast forward to the good part. Courtney, everybody says no. And then Courtney says, but I dig a little deeper, as I've been known to do. And Courtney says, well, I mean, I did. Every so often, as a neighbor, these neighbors, and I'm showing my hands, y'all. She's like, this the neighbor couple I have. I just do, a little bit. So I dig a little more. Y'all, this couple is in their 70s. She and her childrens made themselves responsible for taking care of their trash bins and going over to their house 2-3 times a week just to see if they need something. And then if they do need something, they do it, whatever the something is. But Courtney is sitting right here on this couch, as involved as she is. She over the D-AAA. She in the D-AAA neck deep and still told me not 10 minutes ago, oh, I'm not a caregiver. So listen, y'all, psychologically, for all of us in these United States of America on this here planet Earth, we have to go ahead and acknowledge we're caregivers even when we're not the primary giver of care to a person. You're still a part of that caregiver circle, which matters, and the resources are available to you. Because as you said, at some point, you may need to do more, and it does make a difference if your caregiving load has been building and building and building over decades and decades, and then when you get hit with the big one, maybe you don't have the capacity because you haven't been taking care of yourself because you've been a caregiver a little bit for neighbors for 12 years. And you didn't even know it. So Thank you so much. Now that I want to go ahead and say thank you for being such a good team player, for taking that one for me, Courtney. But she set herself up big time. Set herself up big time. We do hear so much, even within the Parenting Up community, from the United States and abroad, individuals who say, you mentioned this earlier, Dr. McNeill. That's the best I can do for you. Okay, that. Well, this is what I'm supposed to do. It's my husband, or it's my child, or it's my mom, or it's my daddy. Even when that other person on the end of that relationship has treated them poorly. It's just, I'm supposed to, so I'm doing it. It's very obligatory. Therefore, they don't wear or accept that caregiver role responsibility. It turns to burnout. It turns to maybe not the best level of caregiving. I'll be honest, as a caregiver, right? If you're not accepting of the role, and if you're not getting whatever resources possible, maybe better practices or communicating with the doctors, then what if you're a shitty caregiver? Just because you're doing it, just because you're going to your mama's house, just because you're picking up her medicine doesn't mean you're doing it with love.
Are you the best person to do that particular role?
I'm not pointing at you. Y'all, I'm snapping my finger over here at Dr. McNeill, because just because you're doing it doesn't mean you should be doing it. Okay? So all of that is to just digest, first and foremost, are you a caregiver? Like, just really sit with yourself. And we want people to think about that. Are you a caregiver? Are you providing care and concern to someone who can't do it for themselves? I'll tell you one way to put it. If you stop doing it, would it make a difference in their life? Could they do it for themselves? Is there anyone that's going to automatically step in and do it if you stop? Or do you have to call somebody and tap them and say, hey, this is now your responsibility. Hey, other neighbor, you got to go get the trash cans because I'm going on vacation. That means that's your responsibility. So you're caring for that area. What can you all suggest as two caregivers who are in Metro Detroit, Michigan, as, hey, this is how you really get involved in your community? Is it best to come to your websites? Is it best to call for people who may be a little more trepidatious? What is literally the best point of entry? To come to an event, to give you a call, go to a website, go to a clinic, open house, a group session? What y'all think?
Ooh, I would say it's there's a couple points of entry depending on how they're comfortable with. I think the biggest one I like to push is our walk at the Detroit Zoo. We have it annually every year, and it's just a place with a whole bunch of like caregivers. I think we had like over 3,000 people came. And it's just a big support system. Like, you can see people on varying different parts of their journey, and it's free to register, free to attend. Like, I feel like it helps capture how big this cause is and how important and how much it is affecting so many families. So I think, like, if it's something that they're willing to like try out just to see, I would say go there. If they're a little more, they don't want to, meet too many people, I would definitely say like our helpline is the best way to like find out information. Or even if you don't want to talk to a person, like our website, alz.org is another good way.
Okay. When does the walk occur? You said it's annually.
Oh, this year at the Detroit Zoo, it's going to be September 21st.
Okay, so you haven't missed it.
No.
All right. There it is. There it is. Okay. Courtney?
For DAAA, you can always reach out to us via phone, 313-446-4444. You can visit our website, DetroitSeniorSolution.org. Either one of those avenues are our best way to reach out. And just come on out. You can follow us on our socials as well. We have Facebook, YouTube, and Instagram.
Okay. All right. Dr. McNeill, Detroit.
I would say that with the Geriatric Workforce Enhancement Program, our goal is to bring in partners, and these are our partners as well, and collect resources and put them in one centralized location for you. So you can go to A.G.R.E.E.D, A.G.R.E.E.D.Wayne.edu. You'll be sent to Wayne State University, which is committed to improving the care of geriatrics in the Metro Detroit area as well as the state of Michigan, especially with the support of this particular funding. And we are collecting these resources and putting them into one space for you, the website, as well as also the app, as well as also providing you podcasts, partnerships, so that you can get this information any which way you like. We just want you to get it.
Okay, whatever you like.
Whatever you like.
I would shout out that hamburger joint, but since they didn't give a sponsorship, you're not about to get no free shout out over here. But we will say whatever you like, because for the culture, you know what I mean? We're going to always do that. Oh my goodness. This has been such a phenomenal conversation. Without even being a resident here, I already know a few people who I think is incumbent upon me to make sure that I call and let them know, like, about the walk. Hey, how you need to get in touch with DAAA, because there's so many individuals as caregivers who really are not ready to turn that corner into saying, yeah, it's time for me to get involved with my parent or my grandparent. Yes, they are still living independently, but I'm starting to do a little bit more for them. How can I do that intentionally well?
Right.
Well, I'm going to say, get with these organizations and they're going to walk you through that stuff. Don't figure it out for yourself.
Yeah.
There's way too many other people who already have it
Yes.
figured out for you. So thank you. Thank you, ladies, so much for being here. Thank you so much for being here. The Snuggle Up. What's up, Parenting Up family? What up, though? This is our final Snuggle Up for the Detroit tour. Oh my God, I had so much fun being here, learning, connecting, sharing. I've got some phenomenal experts here, some very loving experts. It matters that you are loving and knowledgeable if you're going to be an expert. That's in my opinion. Okay, now to the actual Snuggle Up. All right, so we had some, pretty powerful women here from DAAA, Alzheimer's, and the A.G.R.E.E.D program. You know what I took away? The central Snuggle Up is they got your back. If you are in Detroit or anywhere in Michigan, they already have the resources most likely that you need. Now, let me just say, I know as a caregiver, the first thing and the only thing we really need or want is a cure. So don't come at me in my DMs. They don't have a cure. But resources for caregivers, whether you want to know how to be a caregiver, how to treat your loved one better, how to take better care of yourself, how to manage the medicine, how to connect with other caregivers. They got all that written down. They got ways for you to go and have a night off and party and dance and get the hell out of here. They listed it. I ain't gonna try to lie and tell y'all I remember those websites or telephone numbers. But the point is, press rewind. Whether you're watching this on video or you listening to it. They out here, y'all. You don't have to do this alone. You should not do it alone. They in the trenches getting this grant money, getting this funding, getting these donors to make these pledges in order to walk this walk with you. Man, don't make this burden harder than it has to be. Lean on them. Lean on these organizations. Go ahead and get some lemonade out them lemons. All right? I'm your girl, Jay Smiles, and like I always say, Alzheimer's is heavy, but we ain't gotta be. What up, though? Thank you for tuning in. I mean, really, 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 thank you so very much for tuning in. Whether you watching this on YouTube or if you're listening on your favorite podcast audio platform. Either way, wherever you are, subscribe. Come back. That's the way you gonna know when we do something next. Y'all know how it is. I'm Jay Smiles. I might just drop something hot in the middle of the night.